I'm Rosemary Bell. I'm the Welfare Benefits Advisor for the Mitochondrial Clinic. You'll normally find me in clinic on Tuesday afternoon if you need to see me. I've also got with me cards with my mobile number, and please, please, please don't hesitate to ring. Susan or Claire made reference to the awful forms. Please don't struggle with forms, just speak to me and I'll help you to fill them in. The main focus of this afternoon's talk is going to be personal independence payments, because I know a lot of you are concerned about PIP, which is going to replace disability living allowance. It's for people of working age, first of all. So those of you who are already on attendance allowance, you don't need to worry. We're just looking at people who were between 16 and 64 on the 8th of April 2013. But it also includes existing disability living allowance patients who have an indefinite or lifetime award. You may have thought when you got that DLA award, great, it's for lifetime. Well, that's until the government decided to introduce PIP. So unfortunately, everybody is going to be reassessed under PIP. Children who are up to 16 years of age will carry on claiming and getting DLA at the moment. But the DWP will contact the parent or guardian of a child before their 16th birthday to let them know they should consider claiming PIP. I mean, consider claiming PIP. If you don't claim PIP, the DLA stops. So you don't really have a choice in the matter. You're going to have to claim the PIP. People who were aged 65 or over on the 8th of April 2013 will continue to get DLA as long as they remain eligible. So if you're in that age bracket, when you were 65 or over on the 8th of April 2013, you'll carry on getting your DLA. And as we said, people who are already getting attendance allowance won't be affected. So very like DLA, it's made up of two parts. There's a daily living component, which used to be the old care component under disability living allowance, and the mobility component. And awards are made up of one or both of these components. So you might qualify for the mobility, you might qualify for the care, or you might qualify for both. But each component has two rates, a standard and enhanced. Now the difference with that, with the daily living component, as many of you will know, DLA actually had a lower rate of the care component, which used to be called something like the main cooked meal test. That disappears with PIP. So what we have to do for PIP is to make sure that you're scoring enough points to get you onto the standard rate. Now, the criteria will, this is the DWP, what they say, it will use to assess people is to assess disabled people as individuals, focus on the impact that their health condition or impairment has on their daily lives. So you don't get it just because you've got a diagnosis of mitochondrial disease. What we have to show is how that mitochondrial disease impacts on your daily life. Considers the individual's ability to carry out key everyday activities. And again, most of those daily living activities are to do with personal care. It's not to do with housework. It's not to do whether you can get round the shops. It's just to do with everyday activities, mainly personal care. It takes into account physical, sensory, mental, intellectual, cognitive impairments and developmental needs. Now, for mitochondrial disease, which can encompass all of those things, that's so important. We have to make sure that we describe how you're impacted on. So if you've got the extreme fatigue plus hearing loss, they have to make that clear. If you've got extreme fatigue and problems with your eyesight, we have to make that clear. And it actually now better reflects variable and fluctuating conditions. Used to be difficult with disability living allowance, saying, well, actually, I'm all right on one day, but I'm not all right the next day, which obviously is a feature of mitochondrial disease. It was difficult to express that. With the PIP, if you have the problems for more than 50% of the time, you pass the test. So if you're saying, well, I'm all right on 2 days a week, but I'm lousy the other 5 days, you'll pass the test. And we just have to make that clear. The other thing is that they have to take into account whether activities can be carried out reliably, repeatedly, safely, and in a timely manner. So again, you might be able to do something on a good day, but you're not able to do it the next 2 days. Or you might be able to do something once in the morning, so you get up, you get your shower, and that's you whacked out for the rest of the day. So you have to show those things. We have to make it clear that you might be able to do something once, but you can't do it repeatedly. Now, the thing about PIP as well, do you know when you get those magazines and you fill in those quizzes and then it says you score 4 for A, 3 for B? Yeah. PIP assessment is just like that. You're given points. Now, to get the standard rate for the daily living, you need 8 points. To get the enhanced rate, you need 12 points. We have to make sure that we get you through all those points. And we have to make sure that when we're filling the form in, you're going to score enough to hopefully get you on the enhanced rate. But we have to make sure. And they vary, you see. So preparing food, I've got the full list here. So preparing food, we go from cannot prepare and cook food at all, gets you 8 points. So for someone who cannot, go into a kitchen and safely, reliably prepare food, they'll get the 8 points. But we've got to describe it. We've got to say, what are the problems? It's no good just ticking the ticky box and not writing anything in the big box underneath. You've got to make sure you fully describe what the problems are. Can take nutrition unaided. Well, again, if you look there, D, needs prompting to be able to take nutrition. How many mito patients struggle to complete a meal, to finish a meal? How many, if you've got youngsters who are low body weight and you're having to persuade them, cajole them into eating, how many of you too shattered by the time you've made the meal? How many of you are too shattered to eat the flipping thing? That certainly is something I've come across a lot. So, we have to describe all these things. Things like washing and bathing. You might be able to just stand there in the shower. You might have a bit of problems if you're trying to hold your arms up to wash your hair properly. And then when you get out, you've got to dry yourself. You've got to hold the hairdryer up to dry your hair. If you're a man, you've got to shave yourself, unless you grow a beard, but you've got to shave yourself. If you start to have problems holding your arms up because you're shattered at the end of it, if you're having difficulty bending over to cut your toenails, this is all the stuff we need to get down on that form. Engaging with people face to face. If you don't like meeting people, if you find it very difficult to talk to people over the phone, all these things we have to get down. The mobility component, this is where it really gets tricky. It used to be under disability living allowance that if you are unable or virtually unable to walk, if you can't physically walk, that's easy. You just say, I can't walk at all. Virtually unable to walk, well, it started off at 100 yards, and then it came right the way down to if you could walk more than 40 yards, you wouldn't get the higher rate of the mobility component. We're now up to 20 yards. We're now down to, 20 yards. The length of 2 double-decker buses. And that is one of the problems that we are going to have. But remember again, what did we say? Reliably, repeatedly, in a timely manner. So what we're saying in the terms of the moving around, You might physically be able to put one foot in front of the other, but what's your balance like? What pain have you got? Have you got pain in your leg muscles? Do you stagger a bit? That again is what we need to start describing to make sure as many of you as we can get an award of the higher rate. We can probably get the standard rate, which is the one where you actually need to plan and follow journeys. That scores 10 there, 12 there, but in actual fact, it's actually, that would really be someone who can't go out at all by themselves, someone with severe cognitive impairment. For people who, I mean, for example, you get 10 if you cannot undertake any journey because it would cause overwhelming psychologically distress to the claimant. That'll get you 10 points, but it wouldn't get you the higher rate, the enhanced rate, which is what you need to get to hang on to the higher rate of the mobility component. Now, one thing I should mention here is if by any chance you do get pulled up for a medical, you do unfortunately lose your higher rate and you've got a motability vehicle, and I think that's probably quite a few of you, they've just announced that you will be given £2,000 one-off payment. But what I would be saying here is don't just accept that award. Don't just accept what they're saying, oh, I got this letter, I'm not going to get the enhanced rate anymore. Ask for a mandatory reconsideration. Appeal. Because we've got this secret weapon, you see. It's called letters from the consultant. I'll just talk a bit about what's going to happen about this transition, but then talk a bit about the process we need to go through. So, existing DLA recipients who are between 16 and 64 on the 8th of April will need to decide if they want to make a claim to PIP. Who wouldn't want to make a claim for PIP if DLA is not going to be there anymore? From October 2, 2013, claimants who either had a fixed term award that is due to end, have a change in their care needs, or reach the age of 16 are only being invited to claim PIP if they live in a reassessment area. Now the reassessment areas have been gradually, with maps being changed in colour, as postcode area after postcode area has come under one of these reassessment areas. And most of our area, the north, the Midlands went over first, most of the north and Scotland has now gone over. Surprise, surprise, the last area to go through is going to be the southeast of England. What a surprise. Where are most of the Tory constituencies? Anyway, so because it was the case until February that if you had an award of DLA and you got worse and you now had worse mobility problems and we were going for high rate mobility, we could just get in under the barrier and get your case looked at under DLA. Not anymore. If you have an existing award of DLA, if you ask them to look at your award again now, it will be looked at under PIP. So before you even think of doing that, I would ask you to have a word with me. Because I don't want you to lose what you've got. I don't know yet how PIP is going to be viewed. I don't know, we haven't done enough claims to be sure that as soon as we put down mitochondrial disease, you get a decent award. We were managing it with DLA because we were putting these consultants' letters in. And very rarely were you having to go for a medical. With PIP, most people will have to go for a medical. Except they are so behind with the whole process that if they have sufficient evidence, good evidence, strong evidence, we are getting awards of PIP using consultants' letters and the form. From October 2015, because obviously what I've said is if you've got DLA now, sooner or later, after October 2015, you're going to be reassessed. It's going to be a bit randomised, I think. the people that they're going to be looking at first are people in receipt of an indefinite award or a fixed term award. So if you've got an award that runs out in December 2015, sorry, you're likely to be in the first batches because your DLA award is going to run out and they're going to invite you to claim PIP. If you do claim PIP, your DLA award will continue until a decision on the PIP claim is made. If you don't claim PIP, if you stick the form in the bottom of the drawer and forget about it, and don't claim PIP, your DLA award will stop. So you need to make sure, if you get any of these nasty big buff envelopes coming through with a letter saying you are invited to claim PIP, you don't think, oh no, I'll just hang on to my DLA for the minute. No, no, you have to claim PIP. But you don't need to do anything at the minute. Wait till they write to you. Don't ring up the PIP line. You know, I mean, and there have been, there's forums for advice workers, and they've said, you know, people have thought PIP was a different benefit. So they've rung up and said, can I claim PIP? So they have done, and they already have an existing DLA award. The PIP assessment will involve health professionals who consider the evidence provided by the claimant along with any further medical evidence. Well, for those of you who have been in front of an ATOS medical assessor, you'll know what use they are. I remember a mitochondrial patient talking to me and said they'd claimed employment support allowance and they had to go along for the medical. And the medical assessor came into the room, and the medical assessors aren't necessarily doctors, they're nurses, they're retired GPs who fancies a bit pin money or whatever. And this medical assessor said to a patient with mitochondrial disease, well, I drew the short straw, didn't I? Nobody's got a clue what mitochondrial disease is. So how can that person assess someone who has mitochondrial disease when they know absolutely nothing about it? So that is why, when it says, along with any further medical evidence, please, 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 do not send in a PIP form without making sure you have a good letter from one of your consultants, or Catherine. And I think actually we might actually start going mad and including letters from Jane as well, because I think the more information we can put in, so if Jane is then talking about exercise tolerance, if she's talking about the way your muscles are affected, the more information we can put in, the more likely you are to get an award without going for the face-to-face consultation, because we have been getting PIP reports through with no face-to-face consultation, because the whole thing's in such a mess, quite frankly. Now, I think the longest I had for a PIP claim was 10 months. And when I tell you that that was for a client who was suffering from motor neurone disease, you can see it's bizarre. I've had long waits with mitochondrial patients as well. The government now say, the DWP are now saying it's down to an average of 14 weeks. But if you remember that 14 weeks will include patients who've got what we call a DS-1500, which is a terminal illness form, and they get dealt with in 2 weeks, you can see the reality for ordinary PIP claimants is probably longer. They very kindly say they can take somebody along with them to the consultation. Well, I think that's a good idea to do that. Doug's telling me to get a move on. People with severe health conditions, this is where we're bringing you in. We're getting, you see, we're saying you have got a severe health condition. You're unlikely to get asked for a face-to-face consultation, but that's why we have to make sure the letters make it clear how serious your condition is. The reassessment affects other things: tax credits, disabled child premium, enhanced disability premium, blue badge, carers allowance, motability scheme. So it's not just your DLA stroke your PIP, it's everything else as well. Right, it was a bit galloped at the end, but so basically what I am saying to you is when you get the form, please don't panic. Ring me up. What I'll do is say, sign the bottom of the form, send the form to me. I will then telephone you and we will fill in the form over the phone. I will then go to your consultant and say, can I have a letter of support covering this, this, this and this? We would then send the whole lot in. Okay? If you're doing a fresh PIP claim, the same applies. If you have never claimed PIP before, the same applies. You have to, if it's a fresh claim, you have to phone up and make the initial claim by phone. You've then got 4 weeks to put the second part of the form in. The problem is it takes them 2 weeks to get the form to you, the further assessment form. So by the time I get it, we've got about a week to get the form filled in and a letter from the consultants, which is why I get frantic phone calls saying, I need a letter saying this, this, this and this. But please don't worry, please don't panic, the support is here for you. And I did a quick tot up. We've been doing this for coming up to nearly 3 years. I've got a lot of chasing up of results to get anyway. But we have done over £500,000 in annualised gains. So that means we've got benefits for people to that amount. But as I say, I'm here. If I've spoken to you on the phone, I'd love to say hello to you properly if you introduce yourselves. Meanwhile, I'll let you have, if anyone wants a card, I've got cards as well. Thank you, John.